when we graduated, we all took an oath to do no harm. And yet, so many of us have done much harm to ourselves. So since I graduated, taking care of yourself has been added to the Hippocratic Oath. In 2017, it was added as an addendum because what was missing in medicine for so many years and in my training and in my career is a commitment to taking care of the healers and to the vision that if we don't take care of the healers, they cannot sustainably and ongoing take care of everyone else to the best of their ability and be the best physicians that they can be. So at the core, physician wellness is essentially about doing no harm to ourselves. So caregiver wellness is a huge cultural problem in medicine. And it was brought to the forefront by the pandemic, and it's now reached crisis levels. 1 in 5 physicians is leaving or considering leaving medicine, and almost a physician a day is actually committing suicide because the profession is so challenging to work in, and there's so much stress, and for many other reasons as well. The physician wellness or unwellness epidemic is also tremendously expensive. Money-wise, it is tremendously expensive to replace physicians. It's also tremendously expensive when they are out sick or not functioning optimally. It's tremendously expensive when they die. It's tremendously expensive when they get cancer and autoimmune disease at young ages because they haven't cared for themselves. And it's tremendously expensive when they can't provide the highest quality of care. Physicians are essentially high performance athletes, and they deserve the treatment that would be given to someone who's being asked to perform at that high a level for a very long time. Most physicians work in medicine traditionally for 30 years. And these days, that's not a sustainable proposal when we look at the current state of medicine today. And so I've been working on physician wellness and physician unwellness since residency, really even since medical school. But I have always been someone who spoke up when things did not feel right. And I never understood why, as physicians, we were being told to tell our patients how to care for themselves, how to exercise, eat healthy, do all the things that they needed to live a long and healthy life. And we were not given the respect and privilege of time to do any of those things for ourselves. It was all couched in the name of service and care and sacrifice, and we were saviors. And yet what was happening was that physicians were doing harm to themselves along the way, sacrificing themselves, so that now we find ourselves in a situation where people are not willing or able to continue. And tremendous harm is being done to these humans who have given essentially so much of themselves, they have nothing left to give. When I started working in physician wellness in 2002, it was not a thing. We were in the back closet with no windows and no financial funding. And speaking up was not something that was considered a good thing to do. And yet I am someone who's always felt that when things are not right, you must speak up. And so we find ourselves today in a spot where things have actually gotten significantly worse. Over time, the practice of medicine has changed, the loan burdens have changed, the systems have become much more strained, and the financial setup has been impacted by lots of different business decisions. Medicine has become really a big business proposition in the last 30 years and is very different than how it was practiced before. The art of medicine has very much been lost. Part of the problem is a systems issue, and I always start every conversation about physician wellness acknowledging that the systems need to be fixed, but we also can't wait as physicians for the systems to be fixed. The other contributing factors to the problem are our medical training and the expectations in the medical culture of those who provide the care within it. And we were taught along the way many things ingrained into our minds about how we should show up and what was expected of a good physician, and that if we didn't follow through, we would not be an okay or even acceptable physician. And these expectations are fairly unreasonable. Many of them were the superhero expectations. We were expected to show up with capes on, holding locomotives back, not sleeping, not eating, not even caring for our basic bodily human needs. Many people in medical training got quite sick along the way, and we were actually expected to work sick. And even if family members were extremely ill and dying, we were expected to work. We were expected to work as pregnant residents all the way up until delivery and take minimal time off. As soon as you were able to function, you should be back doing your job, because that's what a good physician did. The other piece that plays into the physician burnout epidemic is the types of people that go into medicine. We are actually inherently part of the problem because we are perfectionists, we're people pleasers, we're high achievers, we're very concerned about being rejected and what other people will think. And so along the way of our training, we took those inherent qualities and then we trained ourselves and the people coming behind us to think and behave in certain ways in the name of service that have actually harmed us, where we've denied our own humanity. And so we were also told that if we didn't follow the rules, we would not be caring about our patients and we would not be a good doctor, which is not true of any physician that I have ever met. Every physician that I've ever met loves their patients and would almost go to the end of the earth to do the right things. And in fact, so many of them do, all the way to the point of no longer being able to practice and doing tremendous harm to themselves. So physician wellness is quite complicated, and there are a lot of things to balance. It's also simple in that if we treated physicians as humans and anyone who works in healthcare as humans, the system would be much more functional and we wouldn't have such a burnout issue. We would have better relationships, we would have better communications, we would actually have better care. We know that healthy, non-burnt out physicians are much better able to provide better care, and it would cost less. So this is a solution that is in everyone's best interests to solve, and yet it is quite complicated. My offering is that it needs to be solved by physicians, by well physicians who are no longer willing to do harm to themselves. We know that if we leave it to the bureaucrats and the institutions, it's not going to be solved. That's what's been happening over the last many, many years. And as I mentioned, 1 in 5 physicians is leaving medicine or considering leaving, and more than 1 a day is committing suicide. The old paradigms for solutions and for our systems of medicine are not working. We need a completely new paradigm because wellness is not fit into the medical model. It's not a checklist. It's not a yoga class. It's not a prescription. It's an approach and a cultural change about how we view those people providing care. And it's a cultural change about caregiving, that we shouldn't be denying the health of the caregivers in order to provide care, that we are all humans. And when we collaborate and work together as physicians and patients, and honestly, as administrators and hospital systems, that's where we will find the solutions. So we cannot find those solutions with burnt out, exhausted caregivers. And so what I offer to my colleagues is that I see it as our responsibility to save ourselves first, and our colleagues alongside us. When we can change our thinking and step out of some of these old thought patterns that we have that lead us to agree to these old systems and make us feel terrible when we want to change or act in a different way, that's where the change will come. When we are whole and healthy healers, we can show up for the conversations, advocate effectively with the energy that and super smart minds that every physician I know has that will lead to the solutions. We can be both part of the solution ourselves and lead the solutions for everyone else. So if we can get physicians out of burnout, which is defined as emotional exhaustion, cynicism, and feeling ineffectual, we can start to solve the problem ourselves. The fix is going to come from starting with ourselves. Then we can help to start to change the system. We can change ourselves and our thought patterns, and then we can change the expectations and model what it looks like to practice healthy medicine. And from there, the ripple effects will ripple out, and we will ultimately get the systemic change that we need. So I want to reflect on a few thought patterns that are instilled into us during residency and medical training that cause a lot of problems. So we often think that harder is better. Harder is valuable. And so we push ourselves to do the harder and the harder. And the more is better, more degrees, more fellowships, more training, more leadership roles. We see ourselves as saviors. And honestly, we see ourselves as superheroes. And with capes on, we're told that we are that. We're told that we can control things that are outside of our control. We're often asked to fix things that are not ours to fix. And so we bring that to the rest of our lives and to our practices and our colleagues and our medical systems and the culture of medicine every day. We also bring catastrophizing in. We tend to always look for the negative and assume the worst. And when we show up that way, we tend to not make the best colleagues in terms of departmental decisions, in terms of taking things in stride, in terms of being present and in the moment. Medicine says that mistakes are our fault, and we've all internalized this. So we're not willing to take risks. We're not as willing to try out new things and be creative. We are used to practice guidelines and doing it the way we're told and following evidence-based medicine. And honestly, physician wellness is a place where we may need to step out of evidence-based medicine. Other thought patterns that are trained into us in residency are scarcity, being concerned that we don't have enough supplies, that in primary care, we don't have enough time, we don't have enough resources. All of this actually might be true, but our focus on it makes the job that we do that much harder. We also notice what's not working rather than what is working. That's what we're trained to do as physicians, but we carry it over to the practice of medicine, to our teams, and to our family life outside. All of these thought patterns lead to significantly more physician burnout and exhaustion and making the job harder than it already is. The final two I wanted to reflect on today are comparing and despairing and victimhood. We tend to compare ourselves to others. That's what we had to do to get through medical school and residency, and notice where we're falling short and work really, really hard to solve it. And so I offer that is a recipe for burnout. And then being a victim, we see ourselves as victims of the system. And when we show up as victims of the system, it is much harder to fix. This comes from also having been victims of residency and other such situations, call schedules, holiday schedules, the way things that are run inefficiently. We are essentially told that things happen to us and they're out of our control and we should just accept them. And then all we were left to do during training was to call out that we were victims of all the things that were out of our control that we had to accept and we weren't allowed to question. And that leads us to a lot of burnout in our lives. We notice where we're victims and we speak up from that space, which is not the best, most effective space to advocate for change. So what we have is a system that is broken, that capitalized on the humans that go into medicine inherently and their sort of weak spots. And then we train these thought patterns into them. And ultimately, we get a recipe of burnout. And so my final offering in this talk is that the solutions need to come from us and they can come from us. We as physicians are the people who can solve the problem. If we take care of ourselves first, put on our own oxygen mask, become whole and healthy healers who can advocate effectively and use our brilliant minds to find the solutions that will work for both us and the patients, we are the ones that care the most about medicine. And when we fix ourselves, we can show up as the change that's needed. So coaching is the way to fix yourself, essentially. It's the way to change your thinking. And it must be done in concert with self-compassion and mindfulness, in my humble opinion. Mindfulness and self-compassion are what set your brain up to allow for the neural rewiring. And rather than pushing through willpower, they allow for sustained change and integration into your life going forward. So coaching allows us to step out of these medical culture thinking problems and ultimately to change our behavior. If we do it with the intention of acknowledging our humanity and no longer being willing to act in ourselves in ways that don't acknowledge humanity, and not accepting it for our colleagues either, that is where change will come. The beautiful thing is that there is evidence for mindfulness, for self-compassion, and for coaching, that they help burnout. They are synergistic and substrates for each other, honestly, for change. So in advocating for them, you can advocate that they are evidence-based. On the other hand, they work best when offered not in the traditional medical paradigm. And in my mind, they should be tried and offered to physicians because we know they help. And they don't necessarily fit the medical model of intervention. So there are so many options to bring in things that help us heal ourselves. So coaching is one model: one-on-one coaching, group coaching, small group coaching, hiring in a coach to help with your group. You can do retreats to take a pause and a respite, set yourself up for full-on mindfulness, self-compassion, and coaching all at the same time. You can practice yoga on Saturdays. I know there's much resistance to this idea of yoga as a treatment for physician wellness. It's not the treatment, but it's one thing to help soothe a frazzled nervous system, to make yourself be more receptive to change. Any of you are welcome to join me for my Mindful Yoga for Healers classes on most Saturdays at 9 a.m. Pacific live. You can sign up on my website, and I would love to have you join me. You can also find recordings of those classes on YouTube. They actually incorporate both mindfulness and coaching. I would love to have you coach with me as well, if that's of interest. I offer both one-on-one and small groups for women physicians, for people transitioning, parenting with presence, and mindful love, knowing that all of these thought patterns that we have ripple into other areas. And so each of these groups is offered with a different focus to find the thing that's just your portal of entry, the spot where you can be willing to jump in and make some change for yourself. So please do no harm to yourself. Put on your own oxygen mask first. It's the only way that we can care for ourselves and honestly save the practice of medicine that we love. When we make the change within, we can show up as a model, and we can lead and be advocates for effective change from an effective, strong, and rooted place. Thanks so much for listening today. I would love to work with any of you. You can reach out on my webpage, www.jessiemahoney.com. You can also find more recordings like this on my YouTube channel under Physician Burnout and Wellness playlist, and others under the Mindful Life Coaching playlist. And you can consider listening to the Mindful Healers podcast, which has lots of reflections on different areas that impact our health and wellness as physicians. Have a beautiful day.